First thing I want to do is explain what I do as a physical therapist. So I own 180 Physical Therapy, and I'm a physical therapist, but as you're going to figure out, I don't believe in regular physical therapy stuff, which is why it's called 180, which is the opposite of what the other people do. So as a physical therapist, I have two main jobs. One is to teach you guys how to prevent seeing people like me, and then the other job is to put you back together after something happens and get you back to play. So if I do a good job of telling you what to do to warm up and cool down, odds of you of seeing me decrease. So I'm basically here to talk to you guys so I can put myself out of business. So just like when you make chocolate chip cookies, you have to have a recipe, you follow the recipe, you end up with chocolate chip cookies. Same thing with injuries. There's certain things that you have to have an injury. You put those things together and you go do the wrong thing and you have an injury. Okay? So there's 4 ingredients to the recipe for injury. First ingredient is gravity. Okay? Gravity is what keeps you stuck on the earth. It causes compression of joints. It's actually a good thing because it keeps you down here so you can keep on moving. But it actually causes problems if you have the other 3 ingredients to the recipe for injury. Okay? So no matter what you do, you're going to have gravity. So we need to figure out what to do to prevent gravity from becoming an issue. Okay? So that's ingredient number 1. Ingredient number 2 is end range of motion. Okay? So if I want to rip this piece of paper, I have to max out its tensile properties. So if I do this, I can't rip the piece of paper. But if I go like this and I get it to the end range, then I can rip it. Okay? So think about that as you as a soccer player. There's no way you're going to pull a hamstring if you're standing here like this. Okay? You're not going to sprain an ankle, you're not going to tear ACL if you're standing in neutral. Okay? But as soon as you go and kick a ball and get all the way out here, then you're at the end range of motion, you can pull a hamstring. As soon as you step in a hole or step on somebody's foot and your ankle rolls here, you're in end range of motion, now you can sprain your ankle. Okay? So, as an athlete, can you be a good soccer player and never get in the end range of motion? Nope. Okay? So, just like gravity, we have to figure out how to be able to be in the end range of motion and not get hurt. Okay? So, first ingredient, gravity, we can't control. End range of motion, we have to get in the end range of motion. Okay? Third ingredient is called the transverse plane. Okay? How many of you have taken like anatomy, physiology? Okay, did you guys talk about planes of motion? Okay, you have 3 planes of motion, what are they?
Transverse.
Transverse. Sagittal.
Yeah.
Frontal. Okay.
Holy smoke.
Pretty good, huh? So frontal and sagittal, and then you got transverse. So transverse plane is basically rotation. Okay. Every injury has a transverse plane component. Okay. ACLs tear because you can't control the rotational component, and it tears. Same thing with ankle sprains. Hamstring pulls. Your hamstrings run diagonally. When you go to kick, if they can't control or tolerate that transverse plane, you pull those. Okay, so every single injury has a transverse plane component. So the only way you can avoid being in the transverse plane is to move like a robot, which would make you a really lousy athlete. Okay, so can you, as an athlete, play soccer without being in the transverse plane? No. Okay, have to be in the transverse plane, have to be in end range of motion, and you have to deal with gravity. So there's 3 ingredients for the recipe that you have no control over. Okay, so the last ingredient is the important one, the only one we can control. Okay, that ingredient is called neuromuscular inhibition. You know what that means? No. What's that?
Your nerves and your muscles.
Okay. So neuromuscular, nerve and muscle inhibition. What's that mean? Okay, so basically, nerve and muscle don't communicate with each other. Muscle can't contract, so you get no muscle contraction and you're weak. Or the muscle misfires, fires late, and doesn't keep things stable. Okay? So if your muscle and your nerve don't work with each other to make that muscle contract on time, and you've got those other 3 ingredients, you're going to get hurt. Okay? The other thing to remember when we talk about injury, we're not talking just acute injury, we're talking chronic injury too. So I get a lot of gymnastics people that are my age that are in chronic pain. because when they were younger, they constantly stretched and worked on flexibility and tore their body apart, and now it's catching up with them because they've got chronic injury. So when I say you're going to get injured if you do that, and you say, well, I did that all the time, I never pulled my hamstring, that doesn't mean that you don't have joint instability that's causing a long-term breakdown. So we're talking injury, acute injury that happens right away. We're talking chronic injury that catches up to you when you get older. Okay. We need to figure out what muscle is. So if I said, give me a quick and easy definition of what muscle is, what would you tell me?
Moves your body.
Okay, moves. How does it move things?
By contracting and swelling.
Okay, contraction. Okay, so muscle is the only tissue that contracts. Bones don't contract, tendons don't contract, fat doesn't contract, only muscle. Not even nerves don't contract. Okay, so muscle has two jobs when it contracts. What would you say the two jobs are? It does one of two things. So if I bend my elbow, my bicep contracts and causes what?
Movement.
Motion. Okay? So muscles either contract and cause motion, or is my bicep contracting?
No. Oh, yeah.
Yeah? If it didn't contract, it'd come down. Okay, so it's contracting. So what's it causing?
Balance. Stability.
Stability. Okay? Muscle contraction either causes motion or causes stability. So muscle has one job, contract. It can contract and do two things. It can either move the joint or it can stabilize the joint. Got it? Okay. So remember that when we get to stretching. So we warm up because we want to increase our ability to perform. So maximize our athletic ability. What's another reason why we warm up?
Heart rate going.
Get your heart rate going, which would increase your ability to perform. What have we been talking about? Injury prevention. Okay, so we warm up to make sure we perform our best, and we warm up to make sure that we don't get hurt. So if I came in here and I said, the worst thing you can do before you do anything athletic is to stretch, you guys would say? Would say what? Would laugh? Okay, so you wouldn't believe it, right? Okay, good. So let's do a little experiment and see what happens when you stretch. So give me you. All right, so I'm going to have you lay with your head up there on your back.
Okay.
How long would you say you should hold a stretch when you hold a stretch?
Like 10 seconds.
Okay. Would you say 30 seconds is better if 10 seconds is good?
Sure.
Would you say 2 minutes is better if 30 seconds is good?
No.
No? Okay, so most people hold stretches between 10 and 30 seconds. Some people hold them for like 2 minutes. Okay, so we're just going to do 10 seconds since you said 10 seconds. Okay, so we're going to test her strength, then we're going to stretch her, and then we're going to test her strength again. So we're basically stretching the ability for the nerve and the muscle to communicate, which is neuromuscular inhibition if they don't communicate. Okay, so don't let me push your leg toward the table.
Okay.
There you go. And don't let me push your leg toward the table. Okay, those feel equally strong.
Yes-ish. Sure. Yeah.
Okay, so it feels normal.
Yeah.
Okay, so let's roll on your tummy. So we just tested your quads to see how strong they were,
Okay.
to see if they can contract. So go ahead and just lay flat and relax. Tell me when you feel a good stretch.
Right there.
Okay. Okay, flip back over on your back. Don't let me push it down.
Oh God.
Don't push it down. Come on, hold. Okay, now compare that to this. Okay, which one's stronger?
This one.
What happened over here?
It just, that's like magic. It didn't hurt.
Okay, so recipe for injury, we can only control one thing. What is it?
The contraction of muscles.
Yep, we just caused neuromuscular inhibition. So we just gave you the fourth ingredient to the recipe for injury and then said go out and play. So what do you think is going to happen?
I'll break something.
So you'll either have an acute injury or start chronic injury, chronic breakdown. Okay? All right. So Now if I said, the worst thing you can do before you go out and practice is stretch, what would you say?
Kudos.
Okay.
Thanks for
Okay. Okay, so I can make all of you really flexible by stretching it, but I just increased your risk of injury because now you can't control the motion that you have. What we want to do is increase your range of motion and increase your strength and increase your stability. So now you can do whatever you want to do. You can get to the end range of motion in the transverse plane and not get hurt. So what we need to do is figure out what we're going to do instead of stretching to increase our performance level and decrease our risk of injury. Okay? So our warm-up needs to go back and look at our recipe for injury. So we're not gonna do anything about gravity, but we know that we have to be in the end range of motion. So when we warm up, we have to put our body in the end range of motion so that when you're on the field doing that stuff full speed, it already knows what's going on. We need to put our body in the transverse plane. So when you get in the transverse plane full speed, your body knows what's going on. We need to turn your muscles on so they fire on time, so that when you get at the end range of motion in the transverse plane with gravity, you don't pop something. Okay. So when you do your running around the track and all that kind of stuff, you can do that stuff first because you're basically just getting your heart rate up and getting going. So I would say do light jog, that kind of stuff first. Then we're going to do the stuff that we're going to do, because that's going to slow things down, get you in all those different positions before you're going really fast, because we don't want to do them fast before you're prepared, because then you can pull things just warming up. And then after that, then you want to do all your full speed. You can do your cone drills, you can do your high knees, your butt kicks full speed, because what we're going to do is basically going to be walking slow, controlled speed and motion.